Hi, I'm Dr. Ivan Salgo from Philips Healthcare, and I'm going to give an overview today about anatomical intelligence in ultrasound. What is AIUS? AIUS stands for Anatomically Intelligent Ultrasound. We live in an age where information is being gathered and transmitted faster than it can be turned into actionable, useful information for humans. Ultrasound imaging is no different than other technological innovation, where we can collect more information than ever before, especially as it comes in 3D. Clinicians need tools that simplify and quicken the process whereby reproducible data can be turned into information that guides therapy. AIUS uses libraries of organ model data gathered from many modalities to create a platform where information from a single exam can be tailored to a patient's specific organ model that yields useful information in less time, with less training, and with less complexity. How does AIUS work? Each patient's organ has characteristic landmarks that are common as long as they develop normally when they were born. Over time, pathology can change the size and other characteristics of the organ, features attributed to the disease process. AIUS works by collecting organ feature data over hundreds or even thousands of patients with different conditions. It then can use an algorithm to adapt certain atlas shapes to the patient's organ in question by using various computer vision algorithms. AIUS can use some interaction by the clinician to select certain feature points so that it does the tedious work of multiple tracings, or even it can work without any user interaction at all. Today's echocardiograms have limitations in assuring that 2D echo images intersect the true apex, as you can see in this slide. They also make geometric assumptions and depend on the user's expertise to train images. How do you think it will be utilized? Any specific clinical segments? AIUS will likely be used to quicken examining 3D volumes to make sure more reproducible quantitative measurements can be made, and so that this can enhance image-guided intervention as well. For example, in cardiology, it is imperative to make reproducible measurements of the left ventricle. It has been shown that patients with heart failure need guidance of drug therapy or pacing devices that improve function and symptoms. The medical literature also shows that 3D echo provides views of the entire chamber and allows quantitation without geometric assumptions. It can be time-consuming, though. Philips AIUS heart model automatically identifies cardiac structures and can quantify chamber size and function in patients with heart disease. What is the benefit? Combined with X-matrix-enabled 3D ultrasound imaging, AIUS has the potential to make ultrasound more accessible, more reproducible, and more efficient. This was shown in a recent clinical study presented at the American College of Cardiology using Philips heart model on 3D ultrasound data when left ventricular size were compared to MRI. So then, as we close, what is the vision for Philips and AIUS? Philips plans on making a suite of AIUS technologies for ultrasound imaging of many organs and for different modalities. In ultrasound, we are starting with the heart and will make many enhancements in releases to come, as well as conduct rigorous clinical studies to ensure that the suite of tools is clinically robust.